Welcome to this explainer. Okay, today we're diving straight into the deep end of Medicare costs, figuring out exactly what you'll be paying in 2026 and as we look ahead to 2027. If you've ever stared at a healthcare bill, wondering where on earth those numbers came from, or if you're gearing up for enrollment and just feeling totally overwhelmed by the sheer volume of info, you're in the right place. We're going to break this complex system down into bite-sized pieces so you can finally take total control of your healthcare budget.
So, let me kick things off with a pretty crucial question. Are you comparing Medicare plans by premium alone? Because if you are, honestly, that's the single biggest budgeting mistake you can make. It's a total trap. A $0 premium might look absolutely fantastic on paper, but if it comes with massive out-of-pocket costs for the exact care you need, well, that's no bargain at all. We really need to look at the whole picture here.
To help us navigate all this alphabet soup without the cognitive overload, we've broken today's explainer down into 5 clear steps. 1. Decoding the alphabet. 2. Advantage versus Medigap. 3. Spotting hidden costs. 4. Programs to lower bills. And 5. Calculating your true cost. Let's jump into Section 1, Decoding the Medicare Alphabet.
So, the reality of free healthcare is always a little tricky, right? While Part A is premium-free for most folks, assuming you or your spouse hit that 10-year Medicare tax work history mark, you absolutely still have other costs to watch out for. Those inpatient hospital deductibles, they're set annually by CMS, and they actually reset per benefit period. Plus, if you end up in a skilled nursing facility, coinsurance kicks in after day 20. Free premium definitely does not mean free care, and since these costs adjust every year, keeping an eye on them is just essential for your budget.
Now, let's talk Part B. The confirmed 2026 standard monthly premium is $202.90. This is what covers your outpatient care, your doctor visits, preventative services, the whole shebang. And yes, it's a noticeable jump from the $185 we saw in 2025. For most of us, this amount is just deducted straight from our Social Security checks, which makes it super easy to forget about. But make no mistake, it is a foundational cost you've got to account for every single month.
But, hey, what if you're a higher earner? Well, that brings us to IRMAA, or the Income-Related Monthly Adjustment Amount. If you fall into this bracket, you've got to watch out for the surcharge. It's essentially an extra fee tacked onto your Part B and Part D premiums. But here's the critical takeaway. IRMAA is based on your tax return from 2 years prior. So your 2027 IRMAA bracket is literally based on your 2025 income. Now keep in mind you can actually request a reconsideration using Form SSA 44 if your income recently took a dive due to a major life event, like retiring. You don't have to just sit there and accept the higher premium if your financial reality has shifted.
Moving right along to Part D, your prescription drug coverage, $2,100. That number right there is your 2026 out-of-pocket cap. Basically, once your covered drug spending hits that exact threshold, your plan steps in and pays 100% of the cost for the rest of the year. The maximum deductible for Part D is set at $615, though you'll find plenty of plans offering lower deductibles. But man, this $2,100 hard cap is just a massive relief for anyone relying on expensive brand-name medications.
All right, moving into Section 2, Advantage Plans versus Medigap.
This is the big crossroads. Medicare Advantage, Part C, often lures folks in with that shiny $0 premium. But remember, you're dealing with an out-of-pocket maximum that can range anywhere from $4,000 to over $8,800, plus variable copays every single time you see a doctor. It's very much a pay-as-you-go model. On the flip side, Medigap policies hit you with a hefty upfront premium, often $100 to over $300 a month, but in exchange, a comprehensive plan, like Plan G, covers almost all your out-of-pocket costs. So the real question here is, do you prefer to pay upfront for absolute peace of mind, or take that $0 premium and risk a hefty bill if you happen to get sick?
Next up, Section 3, Spotting the Hidden Costs.
You really have to watch out for these traps. They're like the underwater part of the iceberg. Imagine you're on vacation, you get sick, and you visit an out-of-network provider while on an Advantage HMO plan. Because of those strict network rules, without prior authorization, Medicare won't cover a single dime, and you are stuck paying the entire bill. Also, keep a close eye on specialty drug coinsurance before you hit that Part D cap. I mean, a 20% coinsurance on a massive specialty drug bill is still a gigantic hit to the wallet. Then you've got skilled nursing facility stays beyond the first 20 days, which applies to both Advantage and Original Medicare. And lastly, never forget that Original Medicare does not cover routine dental and vision. If you need new glasses or a root canal, you are paying totally out of pocket unless you've got a separate policy.
Let's look at Section 4, Programs to Lower Bills.
I cannot stress this enough.
These 3 programs are absolute game changers. First, the Extra Help Program, administered by Social Security, can actually reduce or completely wipe out your Part D premiums and deductibles. Then you have Medicare Savings Programs, which are state-run and can actually step in to pay that $202.90 Part B premium for you. And if you qualify for Medicaid dual eligibility, most of your out-of-pocket costs are handled for you. Here's what I really want you to take away from this. Even if you assume your income is way too high, it is always worth checking your eligibility. The income and asset limits are often much higher than people realize, and they vary from state to state. Oh, and you can apply for these at any time of the year, not just during open enrollment.
And finally, Section 5, calculating your true cost.
Okay, this 4-step formula is pretty much your gold standard for comparing plans. Step 1, annualize your fixed costs. Just take your Part B premium, add your Part D, Medigap, or Advantage premium, and multiply the whole thing by 12. Step 2, add in the deductibles you realistically expect to hit. Step 3 is absolutely vital. Look at your healthcare usage from last year. If you saw a specialist 4 times, well, plan for 4 copays next year. Add your specific prescription costs based on your plan's formulary. And finally, Step 4, add a buffer for the unexpected. If you're on Advantage, that buffer should be capped at your plan's maximum out-of-pocket limit. By plugging your exact medications and actual provider usage into this formula using Medicare.gov's Plan Finder tool, you're going to uncover a far more accurate picture than any national average could ever give you.
As we gear up for the annual enrollment period, I really want to leave you with this question to ponder. What hidden costs are hiding in your current plan? Seriously, think about it. A plan that worked beautifully for you 2 years ago might be quietly draining your savings right now because of changes in provider networks, shifting drug tiers, or even just your own evolving health needs. So, my challenge to you is this. Sit down, run your actual numbers through that 4-step formula, and make absolutely sure you aren't paying for financial traps you never even noticed. Take control of your data, use the tools available on Medicare.gov, and protect your budget. Thanks so much for joining me on this explainer, and happy calculating.